Okay, for those who are unaware, March is Endometriosis Awareness Month, and over 160 million women worldwide are affected by the disease. My next guest, Tara Scott, is the Chief Medical Officer and founder of Revitalize Medical Group and is here to tell us a whole lot more. Welcome to Ticker News.
Thank you. It's great to be here.
Absolutely. So for people that don't know too much about this disease, what should we know right now?
So endometriosis generally affects younger women when they're in the childbearing age, but there's a couple things that there's a delay in diagnosis of approximately 5 years. So many women suffer needlessly without knowing what's going on. And the consequence of that is that 40% of women actually go on to have infertility.
Right. So tell us more about this month now that we're needing to, bring more awareness to what's taking place. How does it all work exactly? And what do people not know enough about this disease, do you think? What are some of the key points that we should be aware of?
So I think part of this month is spreading awareness on being a little bit more proactive about making the diagnosis. And one of the concerns is that, at least in the US with the pandemic, many women aren't getting their electively scheduled surgeries, and that's right now the only way to make the diagnosis. One of the things I'd love for people to know is that 30% of people actually suffer from other symptoms, not necessarily pelvic pain or painful intercourse. It might be some bowel symptoms that you think is irritable bowel. So that's a reason that you may need to know and check to see if that's what's causing it. In addition, in the US at my practice, what we do is we actually check your hormones, and we want to make sure that the hormones are in balance because these girls suffer with higher estrogen compared to progesterone. So finding a hormone specialist to work with you if you're having any symptoms could lead to an earlier diagnosis. Although it's not a genetic problem, it does run in families. So if you know someone in your family is suffering from that, that might be another reason for you to prompt medical attention sooner than you might.
So what can be done? Obviously there's awareness, and that's a big part of the issue, becoming more aware. But then what is being done at the moment, and what do you think needs to be done moving forward?
So in the US, if you're working with an integrative hormone specialist like I am, and what we do is we look for the root cause. So instead of most therapies for endometriosis are aimed only at treating the symptoms. So things like birth control pills, suppressive therapy like Lupron, which basically puts a young girl in a false menopausal state. And there are consequences of that as well, such as osteoporosis and heart disease that can be increased in that state. So what we do in functional medicine is we try to get to the root cause. Oftentimes we see that it's a genetic problem in the way estrogen is detoxified, and that's quite simply rectified by usually dietary changes, addressing stress, and sometimes some supplements as well.
Really enjoy the conversation, and thanks so much for bringing more awareness, Tara. If we want to learn more, where can we head to learn more about Revitalize Medical Group?
So www.revitalizemed.com. I've got lots of free info on Tara Scott and my YouTube channel, trying to spread awareness.
Thanks, Tara. We'll talk soon.
Great. Thank you.